you so much for having us. We're honored to be here today for a presentation on our fellowship. My name is Janelle Vicente. I'm one of the nurse practitioners at the Miami Cancer Institute, Bone Marrow Transplant, HIV Oncology, and Malignant Hematology Department. I'm also the program director for the Malignant Heme and Bone Marrow Transplant APP Fellowship. And this is my colleague.
Hi, my name is Sandra Sepúlveda. I'm one of the nurse practitioners also here at the Miami Cancer Institute. I have been practicing as a registered nurse for more than 20 years and also have a background as a BNT, hematology, oncology nurse educator. And I want to thank you for this amazing opportunity to share information about how we create the fellowship program. And I had the pleasure to be the study coordinator for the fellowship program.
So let's get started. Got ahead of myself there. Give me 1 second. Okay, so this is us. We're going to be talking about the developing of a malignant hematology and bone marrow transplant APP fellowship. The inception of the fellowship really began, first and foremost, based on the need. If you look in the literature, there's been a huge growth or demand for oncologists, and it's projected that by the year 2025, there's going to be a shortage of over 2,200 oncologists. With that being said, obviously the training for an oncologist takes much longer than that of an APP. And in order to meet the needs and bridge the gap for this demand, we need to be able to train professional APP oncology subspecialized providers. And so as it stands, there are no specific board exams or certifications for APPs and oncology subspecialties. So our program decided to take a further look into this and try to develop something for our own APPs. Improved outcomes. So through the fellowship program, about 90% of APPs did not feel ready to participate or practice in the limited hematology with their limited hematology education that they receive from their school and their curriculum. Typically, an APP program is pretty generic as far as the content covered because they have so much to cover. And in our area for malignant hematology and bone marrow transplant, it is a subspecialty within a specialty. So it is rare that we find APPs that already have the necessary experience or background to take on these roles. And most of them really don't feel comfortable or equipped to move forward the first couple of weeks when they get hired. About 68.8% of nurse practitioners who completed a postgraduate education program actually reported being satisfied with the current job role, while only 50.5% of NPs who had not completed the postgraduate education reported the same. So there is an element of confidence that comes with extra education. And when we give our APPs more confidence, they are more capable, more satisfied with their role because they feel equipped to move forward and provide the best possible care. Studies suggest that the prevalence of burnout and compassion fatigue can be substantial and have potential negative consequences for patients. So again, having our APPs fully equipped, giving them the resources to be able to provide the care that they need to provide for our patients helps them be more satisfied, which reduces our burnout rates, which therefore impacts overall patient care and patient outcomes. So the goal here is to not only equip our APPs to provide better quality care so that they have more resources, but to be able to have the patients, give them more access to high quality care. Not just a nurse practitioner who's learning on the go, but someone who's fully equipped to understand what they're doing. And someone who has higher job satisfaction is obviously a benefit for the institution because there's less turnover. And so that's a general idea. Professional development is an additional benefit of the program. As we move through, we talk more about research opportunities, abstract reviews, case reports, conferences, and things like that. Things that we expose them that maybe or maybe not, they may not have done these in their undergrad or their graduate programs to become APPs. So in this fellowship, we have a scholarly and academic approach as well, which we like to move forward because these APPs now go into the clinical setting and have the right resources to continue to develop professionally. This may translate into salary benefits depending on institution. Our institution has adopted a model to move forward and try to compensate fellows or APPs that have gone through a fellowship and are now considered specialty APPs. So that's a new opportunity as well for APPs considering a fellowship program, knowing that this can impact them professionally and financially.
Related with the goals of the fellowship, we need to take in consideration that our main focus or get more focus is related to provide a uniform structure that equips incoming APPs to comprehensively execute their duties with especially. Also, we want to decrease the turnover rates, and actually we have been improving also in our institution. And also we want to stimulate academic growth and research from within the institution to elevate the caliber of a specialized APP. Also, with this fellowship, our goals is to create opportunity for future growth and expansion by research, procedures, and other areas of the specialists. Also, we have a plan for didactic learning that in depth education, the fellowship usually begin with structured didactic sessions that cover the foundation of malignant hematology and bone marrow transplantations with deep knowledge on bone marrow, immunosuppressive therapy, supportive care, treatment modalities such as chemotherapy, CAR T cells, immunotherapy. Also, we want to improve the APP engaged in case-based discussions and tumor board presentation, helping them understand the decision-making process involved in the complex cases as well. Other goals that we can talk about is related with, it's on the other slide. When we talk about things to consider, we can talk about the number of fellows. I think Janelle, that she's the director of the program, she can give you a little bit more explanation about the program, things to consider.
Thank you.
Thank you.
Across the country, there are many different program structures and curriculums, and even the amount of fellows that they'll take on, how many cohorts they take on, it varies. We did do a deep dive in the literature to try to determine the best possible number of fellows for our program to take on. And it seems that the literature supports at least 2 fellows for any initial cohort. And the reason for that being, despite the obvious, there's ever any attrition or turnover, that we still have another fellow to be able to push through, but it's really having that support so that that fellow doesn't feel isolated from the rest of the clinical team who has different responsibilities and clinical duties. And they're able to work together, study together, do projects together, and really build that relationship and support each other through the program. So that helps with completion rates, satisfaction rates. And so we went ahead and started our program with the 2 fellow criteria. There are many programs out there and different certifying bodies. Among them is the ARCPA, the CAPP, ANCC's APFA, and the CCNE program. These are pretty unique. These are different programs that credential APPs. Some of them are more specific to just nursing or nursing providers, and others are more inclusive, such as the CAPP and the APFA programs. So these programs actually are certifying fellowship programs nationally, and this helps maintain quality control as far as the curriculum, the development of the program, the accountability of the program, and exactly how the program continues to move forward. The length of the program can be influenced depending on which credentialing body your organization tends to move forward with. In our process, we actually went with the ANCC APFA organization because they work with Magnet and we have a Magnet hospital here. And in APFA, they have a requirement of a minimum of 9 months for fellowship, no matter what the specialty line is. But given that we started a specialty in malignant heme and bone marrow transplant, we went ahead and extended it to a 12-month program. So currently what we offer is a 12-month fellowship program that covers everything from malignant heme to bone marrow transplant and cellular therapy. We have to have measurable outcomes, and amongst those, we have our fellows give us 12 months worth of case logs to be able to prove their exposure to the patients in this specialty and really justify their expertise given their exposure. Within those case logs, they'll present to us at least 2 cases with a brief overview, like an HPI and an intervention, so that we understand that we can follow their understanding clinically. Additionally, as Sandra mentioned earlier, they're supposed to attend tumor board meetings. They're supposed to present at least 1 presentation on a topic relevant to the specialty, in our case, malignant heme and bone marrow transplant. And And then obviously they have to participate in the lectures. So we were able to, thanks to the support of our leadership and our organization, actually secure the fellows protected time. At this point, we have a full job description for fellowship, for the fellows and APP fellows, which their exclusive responsibility is to be a fellow, to attend these lectures and the rotations that we have aligned for them. And as the program evolves, there is room for improvement, obviously, but this is one of the things that we received as feedback from our previous cohorts, that it was difficult to take on the fellowship program while still having the burden and responsibility of clinical duties. And so having this protected time really allows them to focus and take the most benefit from what the program offers. We have several evaluations throughout the program, summative, informative feedback that we take on to determine whether the fellows are truly responding well and doing well throughout the program. We don't want to wait till we're at the 12-month mark to identify that there's a need or a gap in their learning. So about every quarter, they'll meet with the program director to have a more intense evaluation based on competencies for the subspecialty area and see if there's any gaps. We have preceptor evaluations more frequently, and then we also have self-assessments that they provide for us so we can see their own comfort. Maybe we think they're doing great and actually they don't feel competent still. And then our own retention data did show that after the fellowship program, we had more retention. We had quite a large turnover rate after 2020 with COVID and a bunch of other things. And having taken on several APPs, some of which did not have a background in our specialty area, this fellowship, we believe, was impactful in allowing us to have a higher retention rate in the last couple of years. Funding is a big question or something that comes up a lot when it comes to these fellowships, because obviously there needs to be executive buy-in. There are a ton of different options out there. Amongst them, there's HSRA loan funding available, mostly for primary care settings. There are grants, which you can look through. There's educational grants and other disease-specific grants if you cover that data. And then there's Medicare funding. It is limited, but there is some data out there on how you can have some Medicare funding. And then retention planning. This has become part of our model for retention planning within our organization to equip them correctly and be able to produce more APPs that are qualified within the pipeline as we grow our program.
Also, during the fellowship program, we will have an amazing opportunity on get more specialized related with instructional training. Related with instructional training, I already mentioned about the didactic learning, the way that we train all the fellowships, making sure they do different rotation on different specialists on the hematology malignancies, different through the bone marrow transplant, immunosuppressive therapy. They're also able to learn about CAR-T, immunotherapy, chemotherapy. Also, it's very important to take in consideration the clinical rotations, hands-on training. The APP rotate through various clinical settings, such as inpatient, outpatient. In inpatient, they get focused on managing acute critical ill patients, dealing with patients with high level of infection, graft versus host disease, and other post-transplant complications. Also, the fellows that will rotate through the outpatient clinic, they will follow care for patients undergoing chemotherapy, post-transplant monitoring, and managing chronic conditions. Our fellows will rotate as well through the bone marrow transplant unit. They will be able to learn about the pre-transplant evaluation, donor selection, stem cell harvesting, and the transplant process itself. We rotate also our fellows to the infusion unit, and in the infusion unit, they will be able to gain experience in administering chemotherapy, blood flows, and other treatments, and the possible side effects and complications patients can develop through in different type of infusion. Exposure to all of this stage of care, those rotation typically cover the entire patient journey from initial diagnosis and treatment planning to post-transplant recovery and long-term survivorship. Since we have a long-term survivorship clinic, so we expose our fellow to this specific training to be able to monitor complications long-term and be able to treat it accordingly. Related with instructional training, also we have one-on-one mentorship. It's a mentorship and supervision. Each fellow is usually assigned an experienced hematology or transplant physician as a mentor, and the mentor provides guidance on complex clinical decisions, helps develop the fellows' independent practice skill and support them through the fellowship program as well. We have an amazing interdisciplinary team collaboration. APP work closely with physicians, pharmacists, nurses, and social workers, fostering a multidisciplinary approach to patient care, which is essential for managing complex cases in the malignant hematology and transplant unit. Another way that we train our fellows is through the simulation training. So simulation training through procedure-based learning, fellows may have the opportunity to participate, or actually they participate in simulation labs where they practice procedures such as, to mention few of them, bone marrow biopsy, lumbar puncture, administration of intrathecal chemotherapy, and the management of central venous catheter. During our fellowship program, all of the participants, they had the possibility to get exposed to emergency scenarios. So simulated emergency, transplant-related complications, sepsis, CRS. These allow our fellows to build confidence in managing life-threatening conditions as well. Related with research and quality improvement, this is another part that is very important when we work with fellows. Giving the opportunity to be part of research. Fellows are often encouraged to engage in research projects related to malignant hematology, BNT. This can include clinical trials, retrospective study, or quality improvement initiatives that they give the opportunity to increase the knowledge on research. And also another important point to mention is related with scholarly activity. It means when we talk about scholarly activity, we give them the opportunity to participate in conference, presentations, publishing papers is sometimes a key component of the fellowship program, allowing APP to contribute to advance their field. Evaluation and feedback, how Janelle mentioned in the previous presentation, we do regular assessment. APP fellows are typically evaluated regularly through the feedback sessions, competency assessment, and case review. This ensures that they are developing the necessary skill to manage complex cases independently by the end of the fellowship program. And also the graduate responsibility is another important part that we need to mention when we train our fellows. As the fellowship progresses, APP are given increased responsibility. So we increase the responsibility when we see that they're able to manage more tasks and more complicated cases. And we were able to transition from closely supervised care to more autonomous decision-making under the guidance of the mentors or the physicians.
This is just a brief overview of our actual retention data and some of our goals that we talked about. So for learner professional development, we talked about the presentation that they had to develop on a topic specific to the specialty area, patient case logs for the learner competency, and then self-reported measure. We have an onboarding progress report tool that we do monthly to see how they're doing. So year to date, we have some data talking about the original inpatient cohorts and the outpatient cohorts. Before and after remediation, there was an opportunity for those who said that it was difficult for them to complete the program initially due to lack of protected time to go back and have a second opportunity to do this. Now, moving forward, we've taken that feedback and have built a model for more protected time. But as you can see, the interest is there. APPs, when given an opportunity to remediate and actually complete the components that are required for the fellowship, they did do so. So the reason for lack of completion and lack of success is not a lack of desire. I think there's a huge push towards fellowships and additional training coming from within the APPs themselves. It's really more about giving them the proper structure, including protection of time, so they can truly learn and get the benefit from the fellowship rather than speeding along just for the sake of speeding along. Our first cohort, we had 34 APPs in the department. We made it an optional fellowship, 26 expressed interest, and ultimately of those 26, 20 successfully completed the program. Future program goals. We look to expand the program in many different ways. We want to be able to expand it to other service lines and subspecialties. We're already working on that because, like I said, there's a huge push and excitement for this, both from the executive level, but from within the APPs. We want to be able to push away from broad specialties and become more subspecialized. Just if we're going to see these complicated cases, we should be able to manage them adequately. And in order to do so, we need the proper training. We want to be able to create, part of our vision is to do same-day procedure clinics. Some of our patients in our malignant heme bone marrow transplant world have GVHD, chronic graft versus host disease, other rashes. They have intrathecal chemotherapy or CNS involvement, central nervous system involvement of their diseases, as well as bone marrow biopsies required for diagnostic, restaging, and general evaluation of their condition. So these are all procedures that sometimes delay management of patient care because, insurance authorizations, but mostly a lack of availability or opportunity for appointments. So being able to train our APPs through this fellowship to take on these procedures is one of our goals, to be able to expedite care and increase access for our patients. We have an apheresis clinic led by one of our APPs in the BMT unit. We want to be able to grow and develop that as well so that we can collect more stem cells and move forward with more transplants. We want to have a research fellowship for obvious reasons to produce more academic and scholarly work, leadership fellowship for those that have a goal to grow within this field as a leader. And then we would love to put together an annual fellowship conference to share all our academic achievements, not just amongst our peers, but with local communities and hopefully even a larger platform. So in summary, the benefit of this fellowship is multifactorial. As Sandra and I have shared with you, we've seen that it's increased patient satisfaction. We see that it increased confidence and autonomy within our own APPs. It increased their competency and their efficiency of delivery of healthcare. Patient safety, because if we are equipping our providers to provide the best possible care, patients are going to be safer in their hands. We'll be able to recognize oncological emergencies and disease progression perhaps easier and more readily because we have the right resources to do so. We're going to have stronger multidisciplinary collaboration. That's part of what we recommend and foster within the fellowship as we work with our pharmacists, we work with our nurses, with our dietitians, our social workers, our doctors, and so on. And less as our APPs are more confident and more competent, we suspect, as we've seen in our own institution, less burnout, less turnover, and that will lead to higher retention rates and a greater opportunity for career development and advancement. So like, as we discussed earlier, this is an opportunity to grow as a leader within the field, both intellectually, but also in just the opportunities that it offers, being that you're now a specialized APP. And we are continuing to advocate on behalf of our fellows to have improved access to education and resources as this program continues to evolve. We've seen the fruits of it, the benefit, and definitely this is something that our institution and our executive leadership is backing and supporting because it's been truly fruitful for our organization and for our patients. So thank you all for your time. We truly wish to have been there in person. Unfortunately, Milton changed our plans and we had to stay down here in Florida. But if you have any questions or any concerns, you can reach either myself or Sandra. This is our information, and anything you need from us, we'd be happy to share. We're excited about this program, and we know that many other places are too. And we believe that this should be the new normal for not just our organization, but organizations across the country with specialty APPs.
I want to thank you for the opportunity. Also, you have my contact information, my email address. And if you have any question on how to set up the fellowship program, how to support the fellows, how to create rotations for the APP during the fellowship program, you can reach out to me and I will be more than happy to help. And thank you so much for this an amazing opportunity.
Thank you.